Joining me live is Dr. Nicole Higgins, the Royal Australian College of General Practitioners President. Doctor, thanks so much for joining us. Is the TGA right? Is there a massive demand at the moment for these certain types of medicines, and is that why we're seeing a shortage of 361 medications?
Yeah, Australia is a small player on the global community. The issue is that antibiotics are special medications to treat bacterial infections. And what we're seeing is a shortage of not just the types of medications, but also the formulations that we need. And that's especially impacting children.
So let's talk about that. Liquid antibiotics for children, they're especially scarce at the moment. How bad is it, and why is that particular product scarce right now?
So at the moment, what we're seeing is a rise in some serious bacterial infections in children, such as streptococcus A and bacterial meningitis. What we're also finding is the medications that we use to treat strep throat or skin infections aren't accessible. And so what we're having to do with our pharmacy colleagues is get a little bit creative and change either the formulations that we use, compound adult medications into children's medications. But GPs are also having to find time to be able to ring around to pharmacies to locate these medications.
Are we acting fast enough on this? Because what we're hearing is that this is leading to more hospitalisations. So are we acting fast enough for this? And what do you think of the plan to force manufacturers to hold a 4 or 6 month supply to make sure that this doesn't happen?
We need to ensure that Australia is actually able to stockpile essential medications. And those that are in really short supply need to be quarantined for correct access. And the issue is that, as I said, we're a very small player in the global community and there is a global shortage.
90% of medications, though, are made from overseas. So obviously, I mean, the answer to some of this would be to make them locally. But when you're talking about 90% of medications made overseas, you know, that's a big jump to make sure that these medications are available to be manufactured here locally. Would you say we'd only really pick up a little bit of that in terms of a percentage-wise if there was a push to make them locally? What are your thoughts about that?
Having local manufacturer, look, that would be ideal, but also know that that comes at a significant cost, and ultimately it's going to be patients who are bearing the brunt. It's really important that we have that capacity to bring those drugs into the country in the first place and ensure supply.
Are you worried about the reports that this shortage is forcing pharmacists to resort to inferior alternatives or to make their own?
It's a problem faced by both GPs and pharmacists, where we're trying to find alternatives to the medication that is best practice and that is recommended by guidelines. So we're doing the best that we can with what we've got, but it's not ideal.
Dr. Nicole Higgins, do you think that the situation is likely to improve in the near term, or is it going to get worse before it gets better?
We're really unsure where things are going. The number of drugs that are now appearing on the list is increasing, and the timelines have been pushed out for some of those medications. It's also across a broad group of medications, whether it be for diabetes, cardiac disease, women's health, in this case, antibiotics. So I would like to see within the next 6 months, ideally in the next 3 months, that those drugs start becoming part of our supply again.
Dr. Nicole Higgins, thanks for joining us on Afternoon Agenda. Appreciate it.
Pleasure. Thank you.